Hi, I'm Fatima, student registered nurse looking after Mr. Jason Bilker. Mr. Bilker is an 81 years old male, born on 1st January 1937 in MRNs 123456 under Dr. Turner. On the 3rd of September 2018 at 16 hours, Mr. Bilker was brought by an ambulance with presenting of chest pain and shortness of breath. Mr. Bilker had a prior hospital admission due to unstable angina and history of multiple falls. Patient has known allergies. On arrival to ED, paramedics had handed over that Mr. Bilker denies any chest pain, but was tachypnea with 32 respiratory rate and a low saturation of 82% on room air. At 16:20 hours, I have attended the patient's observation, and the patient was tachypnea with respiratory of 28 breaths per minute. He was saturating 88% and commenced 6 liters of oxygen via Hudson mask. Patient was pneumocardic and normotensive. Patient was also febrile of 36.8. ECG attended and patient attached to cardiac monitoring on sinus rhythm. Clinical review was raised as patient was tachypnea of 28 respiratory rate and saturating at 88%. Dr. Lance reviewed the patient and reviewed ECG, notes no abnormalities. Chest X-ray has been ordered and IV cannula inserted on the left cubital fossa, and blood was taken and awaiting for pathology results. At 16:45 hours, I have attended the second observations and are all within the flags and documented. Dr. Lance ordered 1,000 ml of 0.9 normal saline and commenced it at 17 hours, running 100 ml per hour, as per charted. Mr. Booker was sent to the radiology for chest X-ray, and Dr. Lance reviewed with chest X-ray and diagnosed the patient with mild pulmonary edema. The patient admitted under Dr. Turner and ordered 40 mg IV furosemide, 824. IV furosemide given at 18 hours as per charted and awaiting for effect. After administration, I have done a repeated observation, and upon assessment, Mr. Birkel deteriorated. He was tachypnea with respiratory rate of 32 breaths per minute, saturating 84% on 6 liters of oxygen via Hudson mask, hypertensive with a blood pressure of 180/95, heart rate was 125 beats per minute, sinus tachycardic, air febrile, and patient was only risable only by pain. Medical activated and team leader notified, awaiting for medical team. My recommendation with patient needs continuous cardiac monitoring, monitoring and observation, medical initiated, continue monitoring input and output, and strict fluid balance chart. High risk for patient, increase oxygen therapy, reposition the patient to a high failure procedure when needed, and to conduct and continue monitoring GCS, and to follow up pathology results.